Medigap. Many people new to Medicare feel surprised to find that Medicare covers only 80% of your Part B expenses. Part B is more like your physician expenses. The other 20% can be financially devastating for some people if you're not aware that you need a Medigap plan. You can choose a Medicare supplement that will pay some or all of the 20% for you. We'll discuss those in a little bit. Among other things, supplemental insurance for seniors with Medicare essentially buys you a peace of mind by eliminating the cost sharing responsibilities. So that is Medicare supplements, and we're going to talk more about that in detail here in a minute. So what is the original Medicare? Original Medicare refers to Medicare Part A and Part B. Part A is the hospital, Part B is the physician, clinics, things like that. Again, it was signed into bill, I believe, in 1965 to help seniors with their health care costs. It covers most hospital doctors' expenses, but does not cover everything. So again, probably mention that a few more times just so nobody's surprised. Any balance not covered by the original Medicare is the onus is on the patient. So that's where we're at with that one. What is Medicare Supplement? Medicare Supplement is also called Medigap. Okay, so you hear them both. Optional insurance plans to cover the cost of original Medicare does not cover, so that's why you need the actual Medigap. Where do you get this Medigap insurance from? You get it from the open marketplace. That's just like when you work for an employer, or maybe a union or a teacher's union or what have you. You actually went out and chose what plan you would want, HMO, PPO, whether it was offered by the United, Blue Cross, Humana, any of the big insurance companies. All those insurance companies are vetted by the federal government. So you need to choose wisely for you, that's for sure. Medicare Part A, again, is the hospitalization side. It does cover up to 60 days, and then the price goes up for each day you get charged. So you get Medicare Part A is automatic. That is what you pay into when you are actually working. That's what gets paid out of your paycheck that you've paid into, as long as you've been a citizen in the last 10 years, and you work 10 years in the United States, you actually paid into it. So you won't see any charge come out of that. The check will come from Social Security. Well, actually, that's what you'll be notified by Social Security for Part A before your birthday. When you turn 65, you'll be contacted 3 months beforehand. And then Part B, you will actually get charged, and that is actually going up a little bit here. So you've probably heard some information about that recently in the last few days. That was just announced. We'll talk about that in a minute. But anything beyond 60 days in the hospital, there will be an extra charge, and we'll be going over those as well. There's also an annual deductible for Part B. And again, Part B is Medicare Part B will be paid. That's going up as well. Part B will be going up to $233 a month from $230 a month. So there'll be a $3 upcharge per month for Part B. Again, that will cover about 80%. So let's look at this. These are not completely up to date, these charts here. And I'll be sharing some notes with you when we get done with class here today as well. So you'll be getting a lot of these notes. So this breaks down, this is a good chart because it breaks down all the different plans, anywhere from A to N. F, for some reason, people loved F, and F is no longer existing as far as I can tell. That's what I've been told. Plan N is maybe the closest one to Plan F. So that's what some people are actually choosing. Again, where do you get these? You actually get them from out into the marketplace. Okay. So we could go through each one of these, but you can see the breakdown. So these are the ones. So again, Plan A and Plan B, those are automatic. You choose Plan A and Plan B, again, before your 65th birthday. Medicare kicks in the month of your birthday, the first day of the month of your birthday, your 65th birthday. Okay. Any questions real quickly on this particular one up to this point?
Lee?
Anybody? Yes.
It's Francine. When you say that these plans are available on the marketplace, I don't know what you mean by that. If we go on Medicare.gov, is it going to give us these Medigap options?
You will see the options, but you're actually going to have to go out into the marketplace like the Blue Cross, Blue Shield, United, any of those to buy the plans.
Yes,
That's
but
where you get that's where you get the plans.
okay, if we just want an overview of plans A through N, like we're looking at now, we could see that on Medicare.gov.
Exactly.
Okay, thanks. Thank you.
Yep. Yep. Anybody else? Okay. So here's a little bit of a comparison. There's the Medicare Supplement Plan and the Medicare Advantage Plan. And I'd like to go through this a little bit. So some of the concerns for seniors are restricted network of doctors and hospitals. Under the supplement plan, you don't. On the Medicare plan, you do. So you have that. Co-payments provided, not provided under the supplement, but it is under the Advantage plan. Up to $6,700 a year out of pocket cost. You don't have that under the supplement, but under the Advantage plan, you do. Health plans decides what tests and procedures are provided for you. Okay. Can your plan be canceled? Under the supplement plan, it cannot be canceled, but under the Medicare Advantage plans, you could be dropped depending on your healthcare issues. They might decide to drop you.
Oh my God.
So there's some pros and cons, that's for sure. Ability to travel the country and use any doctor or hospital under the Medicare Supplement Plan, yes. Under the Advantage Plan, no. Is pre-certification required for some treatments? Supplement is no, and Medicare Advantage is yes. And then they also mentioned Mayo Clinic included. Under the Medicare supplement, it is included. So kind of interesting there. And then here's another breakdown. This breaks it down even further between Medigap and Medicare Advantage comparison. And again, we could go through this all day long. There's our pros and cons to every single plan, as you can see. They dropped the Plan F, I believe, in 2020, and you can see people like that because it